Honestly, we know kids with autism just don't get better on their own. It is so important to help kids navigate and learn because they can't do that without treatment programs. This is what's important. Take from what works, use it, make it work for your child. Don't just hope. Hope is a great place to start from, but do. And ABA treatment and treatment is about doing and about seeing the benefits and about success. One of the most difficult things about autism treatment, to be honest, is firstly the parent getting a diagnosis. You go somewhere and somebody says, yeah, your kid has autism, I'm so sorry. Or you go somewhere and somebody goes, I'm not sure, come back in 6 months, I don't know. Some parents walk away and go, yay, my kid doesn't have autism, but I still have that feeling in my gut like there's a problem. Some parents go, I can't wait 6 months. So really getting that first diagnosis, walking away with it, and making that decision as a parent what to do is super important because we know time is of the essence. Though our hearts sometimes tell us to wait and see, we've not yet seen that to be beneficial for the child. So one of the most important things, and probably the hardest thing, is to take that, to embrace it, and then to make that really tough decision of what do I do next. Some of that is then going, now I've got to find a group of people to come into my house, to come intimately into the most, the environment that is so private to me and see everything about me. The most important thing is you have to embrace the fact that your child needs help. And once you take that and you can kind of walk away from that fear and that paralysis, that first step, the second and the third and the fourth steps become a lot easier. A lot of people ask me if autism is a lifelong disability. And that's a really, really tough question to answer because the spectrum is so broad. Every child is so unique and so different. There has been the removal of autism diagnostics. Mainly we know that most children grow, develop, and their autism changes. And as it changes, therapy changes. It doesn't mean that autism goes away, but what it means is that we can develop the most socially relevant behaviors to be a social member of the community. And that's what it's all about. It's not about fitting in. It's about being a community member. It's about being able to have friends. It's about being able to have a job. It's about being able to be a member of your family. All of those included can answer that question if it's a lifelong disability. It can be, but it can change and morph into something so positive that autism doesn't define you. It is a part of you, but it doesn't define you. My philosophy as a provider is that every child has the right and is capable to be a social member of the community. Without applied behavior analysis, that's really difficult to reach for any child. When you look at the spectrum, and when I look at it historically from my 25 years of doing this, I can honestly say that I've never seen a child do ABA and gone, oh, he didn't even do a little bit better. Every child has a capacity, if there's a good ABA program, if we are consistent, to make strides forward. It's not about fitting in. It's about being a community member. It's about being able to have friends. It's about being able to have a job. It's about being able to be a member of your family. When you look at the child and you look at their program, you start to program that child for who they can be. With the onset of augmentative communication, with the onset of more people understanding that ABA is a tool for every child, we have broken this barrier that allows people to understand whether your child grows to be functioning as a job, functioning independently outside the home. That's great success. But great success is not only measured by that. Great success is measured by a child leaving the home and going to the grocery store for 10 minutes with their mom with her other child in her hand and coming home after a 10-minute grocery session and nobody broke down and cried. My passion specifically is children that use augmentative communication, who engage in self-injurious behaviors, who can decrease that behavior and increase the positive behaviors to be social members of the community. Without ABA, sadly, many of those children would have never had accessibility to school, would have never had accessibility to go to the grocery store. Moms and dads would have never gone anywhere with them because of those looks that they get, the fear of being called a bad parent. In my humble opinion, knowledge is power. The more knowledge we have, the more that we can provide a succinct and realistic program for children, the more a community benefits. let's be honest, autism's not going away. We know the numbers are rising. Teachers, people in the workforce, people in schools, if you know how to work with a child with autism, even if that's the first child you've ever seen, the next child that comes along and the child after that comes along will benefit from that teacher. In the olden days, when I was a kid, we were asked to turn away. Don't look at that child. Don't look at that child in a wheelchair. Now, at the end of the day, is we look at children. We see children as social members of the community. When people see children grow, when people establish relationships with people with autism, they start to understand that these young people can be a part of their life, not just by saying hello down the street, but by actually working with them, working next to them. As the executive director of Harmony House, one of the most important things that we started from the beginning when we started our charity was making sure that our children were seen. It wasn't about just having children within a classroom. It was about daily walks through our community. We wanted people to see who we were. We wanted to form relationships with our community, which then resulted in some of the younger people turning into adults, getting jobs within the community. We've gotten so past thinking that people with autism, we hope they can get to school on time. We hope that they can not engage in self-injurious behaviors. We hope that they can talk. Now we're starting to talk about people being social members of our community. That is huge. I have a young girl that is a part of Harmony House who loves animals. We wanted to take that further, and we connected her with a doggy daycare. And one of the most amazing things is that young girl doesn't just want to go there. She's never late to work. She's never sick for work, and she loves being there. So not only is that young lady benefiting by having an amazing job that brings her joy and passion, but the person that owns that facility is now seeing a person in their eyes with a disability actually being in the workforce. Not just, I'm doing you a favor, but you're actually doing an amazing job. I'm a half full kind of a person all the time. Possibilities are everything we should always look at. And by engaging kids in the community right from the beginning, we're giving both the society and the child that parallel, that common ground to build from. So, in an ABA program, philosophically, the first time a child comes to sit in a chair, first time you do any kind of a lesson, we have to embrace the idea in our minds that we're not teaching a child to be in a four-square room and listen to one person. We're thinking about the bigger picture. We are spending so many hours with that child. We're looking at the child from so many different angles that we're like detectives. We know that child, his quirks, what he's going to do in that moment. It's so funny sometimes. You know what that child's going to do almost a second before they know what they're going to do. So when we start to transition to school, we've gone from a very controlled environment into an environment that child is going to all of a sudden not be at home with a sibling or two, but possibly with 20 other children they've never met before. One of the best ways to kind of hurdle that or to bridge that is to build the best relationship with the school as possible. It is so important that we understand that kids will go to school, that teachers will teach kids, and sometimes teachers won't know what to do with kids in that moment. That's where we, respectfully, can come into the school as providers and as families and give as much information as possible to help the school understand how this learner learns. When I walk into that school setting, I'm a visitor in that setting. But that visitor can soon become a family and a team-based person in the relationship that we build. And I think that is only seen in the success level of the child. At home, our team morphs. When a child's at school, the most realistic thing to do is to work with the school to ensure that we are foundationally supporting what they're doing at school. I love when I go into a school and the teacher says, "Does your child know this circle time song?" And I'm like, "No, we don't know that song. Please give me the words. We'll practice it at home." So then when he comes to circle time, he'll know it. And when you see that smile on that child's face because we've practiced it 100 times and he knows it and he looks around and sees the other kids singing it, like, where'd they learn it? It's amazing to see the teacher and the team start to go, that light goes on. I get why we're a team. And when you really see the child in the middle of the table as the pinnacle of this, then that's when you see the program take such a huge leap forward, because everything we've taught at home is now generalized into the world, and that's what it's really all about. I love children of all types on the spectrum, but I'm intrigued and humbled by kids that come to me that engage in self-injurious behaviors but have no communication system. So the last 10 years has really been spent on educating myself, reaching out to professionals, ensuring that I go to every conference, to anybody that knows more than I do about augmentative communication, and ensuring that I can be the best provider for those kinds of children. One of the things I feel that is so important is to never shut the door and think you know everything. It is so key and so beneficial and so necessary to continually read, research, reach out to people. This is not a one-man show. I am so lucky that I still have people from my past, people who are my supervisors, that are continually showing me the direction to go if I'm missing it. And I myself do that to my team. When I train people, I train them to be good thinkers, but we always have to have somebody to fall back on. Because when somebody thinks they know everything, that's a red flag. It is so important to start from the ground up. There is no, I became a consultant because I read a magical book. Because if there was that book, we probably have all read it and not done the hard work. The hard work is getting on the floor. And when I interview people, my interview is, I want you to get on the floor and I'm gonna watch you make a kid smile. I'm gonna watch you make that kid that doesn't giggle. That's how I see a person be humble to know they can teach a child. And if that takes 5 hours and if that takes 500 hours, it doesn't matter, because you have to go from the ground up. Before you learn all the big words, before you learn how to, before you can call yourself a director of anything, you should be proud that you're a line therapist. You should be proud that you are working from the bottom up, because there's no other way of learning it. I think what Canada really needs to do, in my humble opinion, is understand that children with autism grow up. And when you're 18 and you've been in a program that you have been busting your butt to learn, and then all of a sudden you're 18 and the family's funding changes, and all of a sudden you're out of high school, which has been another really secure environment, and then you're in the workforce. We need to get to a place where we've got more education on job coaching, we've got more education in the community on how to provide supports for young adults now with autism to be members within the community, not just working, but in the leisure community. Where do you go to hang out? Everybody should know how to take public transportation. Everybody who's a bus driver should understand and be comfortable with having a person with a disability on your bus. To be able to embrace 1 in 68, which in 5 years is going to be 1 in 55, we can't keep hiding behind, well, there's only one person with autism ever going to be on my bus, or I think I saw a person with autism. At the end of the day these are going to be young people that are going to be seen in every place that you go to, are going to be friends with your children, and are going to be needing a place to go to enjoy life. Work is a great part of life, but so is leisure, and both of those are keenly important to make a whole person. So Canada needs to step up. We need to step up to ensure that we have a really great systematic approach to helping young people transition from the young teens into the mature young adult. What we know about a good ABA program is that it grows. And what happens from day one is having that focus, knowing that that ABA program may not be a year, may not be 2 years, working in the now, taking 1 day at a time, using your data, making sure you're watching your child's growth pattern, but also knowing that as you move forward, the end result, the goal, is to get to that school. When you get to that school, and when you start to build that relationship with school, you start to see that your home program was so beneficial, that all those times that you didn't get to go on a trip, all those times that you gave up on a new car were so worth it, because that consistency and that hard work was almost like putting your child through college at the age of 4. So to me, the best practice is how you see the outcome from toddler to preschooler to schooler to high schooler. Those are the landmarks. Watching your child grow, ensuring that you have the right people at all times encompassing your child to ensure that child's growth continues, that you have the supervision, that you have the team, that you have the drive, that you have that non-give-upness, that you know that your child can and will learn. And when people come to you and say, is this where you're done? You say, I'm not done. I'm still going to keep going until my child reaches that best capacity.